What if I told you that a simple nutritional adjustment could reduce cancer tumor activity by 39%? Not through chemotherapy or radiation, not through experimental drugs or invasive procedures, but through something as accessible as the food on your plate? Let me ask you this. In a room of 100 men with prostate cancer concerns, what if the simple act of consuming specific omega-3 fatty acids could cause 39% of them to show measurable reduction in tumor activity markers within just 1 year? This isn't wishful thinking or alternative medicine speculation. This is what happened in the CAPFISH 3 study, a rigorous scientific investigation that followed 100 men over 12 months, tracking a specific biomarker called Ki-67 that indicates how aggressively tumors are growing. Today, we're exploring the profound connection between omega-3 fatty acids and cancer prevention. We're going to understand why this relationship exists, what the science actually shows, and what it means for you and your family's long-term health. But here's what makes this conversation even more important. This isn't just about cancer prevention. The omega-3 and omega-6 fatty acid relationship touches every system in your body. It affects your cardiovascular health, your brain function, your mental well-being, your energy levels, your inflammatory status. Understanding this connection changes how you think about food, about nutrition, about what it means to truly nourish your body. Let's start with the fundamental question. What exactly are omega-3 and omega-6 fatty acids? These are polyunsaturated fats that your body can't produce in sufficient quantities. They're called essential fatty acids because you must obtain them from your diet. But here's what most people don't understand. These two types of fatty acids don't work independently. They exist in a delicate balance in your body, and this balance determines everything from how inflamed you are to how well your cells function. Think of it like this. Omega-6 fatty acids are like a pro-inflammatory team. Your body uses them to create inflammatory signaling molecules that stimulate immune responses, blood clotting, and cell growth. These functions aren't bad in themselves. Your body needs inflammation to fight infections and to heal injuries. But when you have too much omega-6 relative to omega-3, your inflammatory system stays in overdrive. It's like having firefighters constantly running around looking for fires to put out, even when there's no emergency. Omega-3 fatty acids, on the other hand, are your anti-inflammatory team. They produce signaling molecules that reduce inflammation, support healthy blood flow, and calm down overly active immune responses. When you have sufficient omega-3 relative to omega-6, your inflammatory system can respond appropriately to actual threats while remaining calm the rest of the time. Here's the problem with our modern diet. The typical Western diet has a ratio of omega-6 to omega-3 that's somewhere between 15:1 and 20:1. That means for every 1 unit of anti-inflammatory omega-3, you're getting 15 to 20 units of pro-inflammatory omega-6. But researchers who study ancestral diets and optimal health suggest the ratio should be closer to 4:1 or even 2:1. Why does this matter for cancer? Let me explain what the science has revealed. The CAPFISH 3 study took 100 men who were at risk for prostate cancer progression. They divided them into groups, and one group received high doses of omega-3 fatty acids for 1 year. Researchers monitored their progress by measuring a biomarker called Ki-67, which indicates how actively tumor cells are dividing and proliferating. The higher the Ki-67, the more aggressive the cancer is growing. After 1 year of omega-3 supplementation, the group receiving omega-3 showed a 39% reduction in Ki-67 markers compared to the control group. This means tumor activity was measurably lower. The cells were dividing less aggressively. The cancer was less active. But here's what's even more fascinating. This wasn't just an isolated finding. A second phase of the study followed 55 men with even more rigorous monitoring, and the results were consistent. Omega-3 fatty acids were associated with reduced cancer activity. Now you might be wondering, how exactly does this work? What's the mechanism? Let me explain what researchers believe is happening at the cellular level. First, omega-3 fatty acids reduce inflammation throughout your body. We know that chronic inflammation creates an environment that supports cancer development and progression. When cells are in an inflamed state, they're more likely to mutate, more likely to divide aggressively, less likely to die when they should. Omega-3 fatty acids calm this inflammatory environment, creating conditions less favorable for cancer development. Second, omega-3 fatty acids affect how cells signal to each other. Cancer cells communicate with their environment, receiving signals that tell them whether to grow, divide, or die. Omega-3 fatty acids change the composition of cell membranes, making them more fluid and responsive. This affects how signaling molecules work, potentially making cells less responsive to growth signals that cancer cells depend on. Third, omega-3 fatty acids may influence gene expression. The field of epigenetics has revealed that what you eat doesn't just provide calories or nutrients. It can turn genes on or off. Omega-3 fatty acids have been shown to influence the expression of genes related to inflammation, cell cycle regulation, and programmed cell death, all processes that affect cancer risk. Fourth, omega-3 fatty acids affect the metabolic environment around cancer cells. Cancer cells have unique metabolic needs. They consume large amounts of glucose and produce energy differently than normal cells. Omega-3 fatty acids may create metabolic conditions less favorable for the aggressive growth patterns that characterize cancer. But here's what's crucial to understand. The benefits of omega-3 fatty acids aren't limited to prostate cancer or cancer prevention in general. This nutritional approach touches virtually every system in your body. Let's talk about cardiovascular health. Omega-3 fatty acids have been extensively studied for their effects on heart disease. They reduce triglycerides, lower blood pressure, reduce the risk of abnormal heart rhythms, and decrease the formation of arterial plaques. The anti-inflammatory effects that help with cancer also help your cardiovascular system function more efficiently. Let's talk about brain health. Your brain is approximately 60% fat, and omega-3 fatty acids, particularly DHA, are crucial for brain structure and function. Research has linked omega-3 intake to better cognitive function, lower risk of depression, reduced anxiety, and even slower cognitive decline with aging. When your brain cells have healthy, fluid membranes rich in omega-3, they communicate more effectively, process information more efficiently, and resist the effects of stress and inflammation. Let's talk about mental health. Omega-3 fatty acids have been studied extensively for their role in mood disorders. Multiple studies have shown that people with higher omega-3 levels have lower rates of depression and anxiety. The anti-inflammatory effects of omega-3 may play a role, as chronic inflammation has been linked to mood disorders. Additionally, omega-3 fats influence neurotransmitter function and brain cell membrane health, both of which affect how you feel emotionally. Let's talk about your immune system. When omega-6 levels are too high relative to omega-3, your immune system tends toward excessive inflammatory responses. This doesn't just affect cancer risk. It affects your susceptibility to infections, autoimmune conditions, allergies, and how well you recover from illness. Optimal omega-3 levels support a balanced, responsive immune system that can fight threats when needed, but remains calm otherwise. Let's talk about your joints and connective tissues. Omega-3 fatty acids have been shown to reduce joint pain and stiffness in conditions like rheumatoid arthritis. This happens because omegas reduce the inflammatory processes that contribute to joint inflammation and damage. Your body's ability to repair and maintain healthy connective tissues improves when inflammation is balanced. Let's talk about your sleep. Research has linked omega-3 intake to better sleep quality, deeper sleep stages, and improved rest. This is likely because omega-3 affects the production of sleep-regulating hormones and reduces inflammation that can interfere with restful sleep. Let's talk about skin health. Omega-3 fatty acids support skin barrier function, reduce inflammation that contributes to acne and other skin conditions, and help maintain healthy, hydrated skin. Your body's largest organ reflects the quality of what you're putting into it. Let's talk about fertility and reproductive health. Omega-3 fatty acids are crucial for hormonal function, sperm quality, egg health, and fetal brain development during pregnancy. The inflammatory balance that omega-3 helps maintain affects reproductive health in profound ways. I want you to understand something crucial. These aren't separate benefits happening in isolation. Everything is connected. When you optimize your omega-3 to omega-6 ratio, you're not just reducing cancer risk, you're creating a cascade of positive effects that improve how every system in your body functions. Your inflammatory status affects your cardiovascular health, which affects your energy levels, which affects your ability to move and exercise effectively, which further supports inflammatory balance. Your brain health affects your mental well-being, which affects your stress management, which affects your hormonal balance, which affects your inflammatory status. Everything connects back to everything else. This is why we need to think holistically about cancer prevention. It's not just about one nutrient or one strategy. It's about creating an internal environment that doesn't support the development and progression of abnormal cell growth. Omega-3 fatty acids are one powerful tool in creating that environment, but they work best when integrated with other health-supporting strategies. Let me talk about practical implementation. What can you actually do to optimize your omega-3 intake? First, let's identify good sources of omega-3 fatty acids. The most concentrated source is cold water fatty fish like wild-caught salmon, sardines, mackerel, and herring. These fish accumulate omega-3 fatty acids because they eat algae and smaller fish that are rich in these fats. The recommended intake varies, but generally aiming for 2 to 3 servings per week provides substantial omega-3. There's an important distinction to understand. The omega-3 in plant sources like flax seeds, chia seeds, and walnuts is in a form called ALA, alpha-linolenic acid. Your body can convert alpha-linolenic acid to the more active forms eicosapentaenoic acid and docosahexaenoic acid. But this conversion is inefficient. Only about 5% of ALA gets converted to EPA, and less than 0.5% becomes DHA. While plant sources of omega-3 provide some benefit, animal sources provide EPA and DHA directly, making them more effective for increasing active omega-3 levels in your body. Second, consider omega-3 supplementation if you don't regularly eat fatty fish. High-quality fish oil or algae-based omega-3 supplements can be effective, particularly if you choose products that have been tested for purity and potency. Look for supplements that provide at least 1 gram of combined EPA and DHA per day. Third, be conscious of your omega-6 intake. The goal isn't necessarily to eliminate omega-6 fatty acids. Your body needs some, but you want to reduce excessive omega-6 consumption from sources like vegetable oils, processed foods, and conventional meat from animals fed grain-based diets. When you reduce omega-6, even moderate omega-3 intake becomes more effective because the ratio improves. Fourth, choose quality sources. Not all omega-3 sources are created equal. Wild-caught fish generally have better omega-3 profiles than farm-raised fish, because farm-raised fish are often fed diets that reduce their omega-3 content. Similarly, grass-fed or pasture-raised animal products have better omega-3 to omega-6 ratios than conventional products from grain-fed animals. Fifth, understand timing. While omega-3 fatty acids provide benefits at any time, some research suggests that taking them with meals that contain some dietary fat can improve absorption. Additionally, Omega-3 fatty acids are most effective when you're also implementing other health-supporting strategies like regular movement, stress management, and sleep optimization. But here's something equally important. You need to understand that changing your omega-3 to omega-6 ratio isn't an immediate transformation. This is a marathon, not a sprint. Your cells replace their membranes over weeks and months. The anti-inflammatory effects build gradually. The benefits compound over time. Think about it this way. If you've been eating a diet high in omega-6 and low in omega-3 for years or decades, your cell membranes throughout your body have incorporated omega-6 fats. Replacing these with omega-3 fats takes time as cells naturally turn over. This is why consistency matters more than perfection. The research shows measurable changes in blood omega-3 levels within weeks of supplementation or dietary changes. But the more substantial benefits, the kind that affect cancer risk and long-term health outcomes, develop over months of consistent omega-3 optimization. I want to address something important about omega-3 and cancer risk. This isn't a magic bullet that guarantees you'll never develop cancer. Cancer is complex and multifactorial. Genetics, environmental exposures, stress, sleep quality, movement patterns, and numerous other factors all play roles. Omega-3 fatty acids are one powerful tool, but they're most effective when combined with other cancer preventive strategies. For example, research consistently shows that regular physical activity independently reduces cancer risk. When you combine omega-3 optimization with regular movement, you're creating synergistic effects. Exercise improves how your body utilizes omega-3 fatty acids and reduces inflammation independently, amplifying the benefits of both approaches. Similarly, managing stress levels is crucial. Chronic stress elevates inflammation and cortisol, creating an environment more favorable to cancer development. When you combine omega-3 intake with effective stress management, you're addressing inflammation from multiple angles. Sleep quality matters profoundly. Poor sleep disrupts immune function, increases inflammation, and affects hormone production. When you support optimal sleep while maintaining healthy omega-3 levels, you're creating conditions that strongly resist cancer development. Weight management matters. Excess body fat, particularly visceral fat, produces inflammatory molecules that contribute to cancer risk. When you optimize your omega-3 to omega-6 ratio while also achieving and maintaining healthy body composition, you're reducing inflammation from multiple sources simultaneously. The key insight is this: cancer prevention isn't about finding one perfect solution. It's about creating a constellation of factors that support optimal cellular function, balanced inflammation, and robust immune surveillance. Omega-3 fatty acids are one of the most important pieces of this puzzle, but they work best when integrated with a holistic approach to health. Let me also address something practical. You might be wondering about cost and accessibility. Fish, particularly wild-caught fatty fish, can be expensive. Omega-3 supplements are an ongoing expense, but here's the perspective shift that matters. This is an investment in your long-term health, potentially reducing future medical costs, increasing your vitality and quality of life, and possibly extending your healthy years. Additionally, you don't have to do this perfectly to see benefits. The research on omega-3 shows that some is better than none. Even modest increases in omega-3 intake create measurable benefits. Start where you are. If you can't afford wild salmon regularly, incorporate sardines, which are typically more affordable and equally rich in omega-3. If supplement costs are a concern, start with one quality supplement and be consistent, understanding that consistency matters more than the most expensive product. I also want to address quality and safety concerns around omega-3 sources. Some people worry about mercury or other contaminants in fish. The reality is that smaller fish like sardines and anchovies have lower mercury levels than larger predatory fish. Additionally, reputable omega-3 supplements are typically purified to remove contaminants. the benefits of omega-3 intake generally far outweigh the risks from potential contaminants. But if you have concerns, choose smaller fish and tested supplements. Let me now connect this to the emotional and spiritual dimensions of health. When you make choices to optimize your omega-3 intake, you're doing more than consuming a nutrient. You're making a conscious decision to invest in your long-term well-being. You're choosing to create conditions in your body that support vitality rather than merely avoiding illness. There's something empowering about understanding the science behind nutrition. When you know why omega-3 fatty acids matter, when you understand the mechanisms by which they support your health, you can make informed choices rather than following trends or fear-based marketing. Knowledge gives you agency. Additionally, the research on omega-3 and cancer reveals something profound about the relationship between diet and disease. We often think of food simply as fuel or pleasure, but science is revealing that food contains information. The omega-3 and omega-6 fatty acids in your food send signals to your cells, telling them how to function, how to respond to their environment, how to communicate with neighboring cells. This understanding transforms eating from a passive act into an active choice about the information you're providing to your body. This is particularly relevant to cancer prevention because cancer emerges when cells lose the ability to regulate their growth and behavior appropriately. When you provide your body with omega-3 fatty acids, you're giving cells the building blocks they need to maintain healthy, responsive cell membranes and optimal cellular communication. You're supporting the systems that naturally resist abnormal cell growth. I want to end by bringing us back to where we started. The CAPFISH 3 study showed that among 100 men at risk for prostate cancer progression, those who received omega-3 supplementation showed 39% less tumor activity. This wasn't a theoretical benefit. This was a measurable change in a key cancer biomarker. But here's what I want you to take away. This 39% reduction isn't just a statistic. It represents real men who experienced reduced cancer activity. It represents the potential for you to reduce your own risk of aggressive cancer development through nutritional choices. The science is clear, the evidence is compelling, the pathway is accessible. Omega-3 fatty acids, whether from quality fish sources or well-chosen supplements, can be one of the most important things you do for long-term cancer prevention. But remember, this isn't just about avoiding illness. When you optimize your omega-3 intake, you're simultaneously supporting cardiovascular health, brain function, mental well-being, immune function, joint health, skin health, and more. You're investing in your quality of life today while reducing your risk of serious diseases tomorrow. So, here's my question for you. Given what you know now about the omega-3 and cancer connection, what's one thing you can do this week to improve your omega-3 to omega-6 ratio? Maybe it's choosing salmon instead of steak for dinner twice this week. Maybe it's starting a quality omega-3 supplement if you don't currently take one. Maybe it's simply becoming more aware of the omega-6 sources in your diet and making small reductions. Every step matters. Every choice compounds over time. The research shows that the benefits of omega-3 optimization are real and measurable. The question is, what will you do with this information? Because the truth is, you have more influence over your cancer risk than you might have realized. The science has revealed that nutrition matters profoundly. Omega-3 fatty acids can be a powerful ally in your cancer prevention strategy. But they only work if you actually consume them consistently. Let me share some crucial details that deepen our understanding. The research shows that inflammation directly promotes tumor growth. Omega-6 fatty acids, which dominate our modern diet, create pro-inflammatory signaling molecules. The typical Western diet has a 15-to-1 or even 20-to-1 ratio of omega-6 to omega-3, when the ideal should be closer to 4-to-1 or even 2-to-1. Your body simply cannot maintain optimal cellular function under these conditions. Omega-3 fatty acids change the physical properties of cell membranes, making them more fluid and affecting how cells communicate. Cancer cells often have altered membrane properties that support uncontrolled growth. By improving membrane fluidity through omega-3, you're supporting healthy growth regulation. Additionally, omega-3 fatty acids influence the production of resolvins and protectins, specialized compounds that actively resolve inflammation. Without adequate omega-3, inflammation can become chronic because your body lacks the tools to properly resolve it. When omega-3 fatty acids support proper inflammatory resolution, they're supporting your lymphatic system's ability to clear cellular debris and abnormal cells. This is natural cancer surveillance that your body performs continuously. Timing and quality matter. Omega-3 fatty acids are best absorbed when taken with dietary fat. If you're taking a supplement, do it with a meal that contains some healthy fats. Remember, consistency beats perfection. You don't need to eat wild salmon every single day. What matters is that you consistently provide your body with omega-3. Even modest daily amounts, when sustained over time, create measurable changes. 2 to 3 servings of fatty fish per week, or a quality supplement taken consistently, creates a foundation that compounds over months and years. This is why the CAPFISH 3 study followed participants for a full year. The benefits accumulate as your cellular infrastructure improves. Start where you are. Make one change this week. Build from there. Trust that your body responds positively when you provide it with what it needs to function optimally. The research is clear. The path is clear. The time is now. Important medical disclaimer. The information provided in this content is for educational and informational purposes only. It is based on scientific research, expert knowledge, and holistic health principles gathered from various sources. However, this information does not constitute medical advice, diagnosis, or treatment, cannot replace professional medical consultation, should not be used as a substitute for qualified healthcare, may not be appropriate for your specific health condition. Critical requirements. Always consult with qualified healthcare professionals before making health decisions. Seek immediate medical attention for urgent health concerns. Discuss any health changes or new symptoms with your doctor. Ensure any supplements or lifestyle changes are appropriate for your individual situation. Consider your personal medical history, current medications, and health status. Limitation of liability. The authors and publishers of this content assume no responsibility for any adverse effects or consequences resulting from the use of any information, suggestions, or procedures described herein. Individual results may vary, and health outcomes depend on numerous factors beyond the scope of this content. Professional medical care. This content encourages and emphasizes the importance of maintaining regular contact with qualified healthcare providers for proper medical care, diagnosis, and treatment of any health conditions.